Hello, friends. Welcome today to the class, and good day as usual to every one of you. We're going to just discuss something very quickly, and today we're discussing public health. And what we are discussing today is access to healthcare and its impact on public health. As access to healthcare and its impact on public health. So the first question we'll quickly ask ourselves is what is impact? What is access to healthcare? So access to healthcare simply means the availability of healthcare services for people at the time these services are needed. So the how easy, how possible is it for an individual who needs to access healthcare facilities, who needs access to healthcare? How easy and possible is it for that individual to access these services? Now, this availability or ease of access is in, is important because it has effect on public health. It has effect on the health of population. So let's look at the this relative ease or difficulty as it may be. Let's look at some of the impact that it has on public health. So the first question we might ask ourselves is what are some of the factors that can affect access to healthcare? That's what are some of the factors that could make it maybe easy or difficult to access healthcare. Number one is geographical location, where you live. You find out that it's much easier for people who live in urban areas to be able to access healthcare. So you have hospitals, you have clinics, you have tertiary health centers. So it's way easier for them than people who live in rural areas, people who live in the hinterlands. They may find it much more difficult to access healthcare. So your geographical location is the number one factor that affects your access to healthcare. Now, apart from your geographical location, you can also look at things like economic barrier, the cost. So, depending on your socioeconomic class, how rich, how much access do you have to funds, that's going to affect, your ability to access healthcare. So, obviously, those who have more money are able to access healthcare much better than those who have less money. So, geographical location, economic barriers. You also have health infrastructure. These healthcare facilities, are they available? You know, you can find someone traveling 5 6 hours to access a particular kind of healthcare facility. Let's say someone has to do something with cancer care and is not available within his vicinity. He may have to travel, 6 7 hours. So health infrastructure, its availability also affects the ease of accessing healthcare. If infrastructure are available in your locality, you find it easier to access healthcare than when these infrastructure are not available. So also you can, tie it back to the issue of location also. Those in rural areas obviously have less facilities available to them than those in the modern areas. Also, there are the issues of culture and social barriers. Culture and social barriers can also be issues. Some people in their culture may not encourage them to access certain kinds of healthcare. For an example, delivery. Very simple example. Some cultures want to, encourage people within that culture to have those their children with maybe traditional birth attendants or at some other place apart from the hospital. So culture can affect your access to healthcare, and this is really important. Also, beliefs, cultural beliefs. You know, give you a simple example: vaccination. If people are not well educated and they can just reject vaccination, say they are not interested in being vaccinated because they feel their culture and teachings are telling them that these things can be used for evil, maybe for sterility. So this is important to know. Culture and social barriers can affect one's access to health. There are also policies and legal factors. There are many policies that have to do with insurance policies, depending on where you live, what part of the world that you stay. There might be policies that make it difficult. Government laws, government regulations may exist that make it difficult for a person to access healthcare. These are all factors that can affect one's ability to access healthcare. Now, what are the impact of these? What's the impact of being able to access healthcare? That is, if it is difficult for somebody to access healthcare, what are some of the impacts that this can have? The first one is health inequalities. When you talk about health inequalities, you're looking at the disparity that exists between different socioeconomic class, educational level. These disparities, what we mean by disparities is that you find out that different classes or levels of people are able to access health better than others. So, in some kind of classes, people who have higher socioeconomic class, for example, tend to enjoy healthier lifestyle because they have more money to pay, and then due to all these health inequalities, they are at a better position. They have more money, they have more access, and so this kind of disparities that we see between the different classes and types of people or cultures, we refer to them as health inequalities. So what we say is that if access to healthcare is really reduced or is very difficult for a lot of people, it increases health inequalities. It makes it become more obvious that some people have better access to healthcare than other kinds of people. Now, we also have chronic disease burdens, diseases such as cardiovascular diseases, your cancer, your diabetes, this kind of chronic diseases that are not caused by infectious agents. The disease burden is rising gradually in the world, and you find out that when people don't have enough access to healthcare, it's also increasing the burden of these diseases. So more and more people are coming down with these diseases, these chronic diseases, because they have poor access to healthcare, and this is a problem. Now, access to healthcare also brings poor access to healthcare is also going to cause an increase in health cost. If very many people are chasing very few health facilities or health services, of course, those services will become more expensive, making it even more difficult for these people to access these healthcare services. We also have mental health impact. Mental health will be affected. Mental health of different people will be affected when they find it more difficult to, access healthcare. So with that brings depression, brings strain, and makes life more difficult and unbearable for people. Now, let's just quickly round off this by asking ourselves, what are some of the strategies that we can use to improve access to healthcare? Strategies that we can use to improve access to healthcare. There are quite a number. Governments can work on having universal health coverage. More work needs to be done to make health accessible to very poor people, the rural areas, in the semi-urban and urban areas. So there is a need to improve health coverage. This will help to increase access to healthcare and help to make people more healthy. Also, we can make use of more telemedicine. Telemedicine is where you're using tools of technology, internet, to be able to bring healthcare closer to people. So telemedicine can help so that places where there's not enough healthcare personnel, there are not enough doctors, by means of telemedicine, healthcare, health expertise can get to people in such areas, and this can be used to deepen access to healthcare. This is important. There's also you can the use of community health programs. Different community health programs can also be used to increase access to healthcare. Different outreaches, campaigns, education, all these kind of things can be helped to increase access to healthcare. Lastly, governments should also work on expanding the number of healthcare workers. There should be more access to medical education. If there's more access to medical education, have more nurses, more doctors, more physiotherapists, more radiologists. All of this will help to increase access to healthcare. So that just brings us to the end of this little discourse on, access to healthcare and its impact on public health. Thank you for listening. It's quite an interesting discourse. Find time to listen. Remember to like, share, comment, give us topics, and remember to have a wonderful day. Thank you very much.